Greetings, distinguished brothers of the Association of Tennessee Alphamen. Uh, it is a pleasure to have you here. I want to welcome you all to the grand opening, or the intro, I should say, of uh, awareness, mental health awareness month. Um, we're going to kick off this month with just an introductory session of all about uh, mental health awareness. And then from that point, we can, as the month goes on, we can progress into different focuses each week. Um, I want to bring on, first of all, a little bit about myself. I am fall of 2017 initiate of the Alpha Delta Lambda chapter right here in Memphis, Tennessee. And our distinguished brothers who are with me can share with you who they are and how they started this great and grand organization. So without further ado, let us begin.
Good evening and hello to all of the brothers out there and to all who are listening. My name is Dr. Keith Lindsay, and I'm a proud member of the Associated Tennessee Alphamen, and I'm happy to be with us today to talk and to really talk a little bit about Mental Health Awareness Month, and as we heard from Brother Brazel, to discuss why this is so important. So to kick off this occasion, we're going to start with a mental health professional, by all means, educated in this field, working in this field. And so it's a privilege to have this individual within our ranks to be able to share this information with us today, to be able to put us on a better track about how do we become better mental health advocates. And so we're going to kick off this month with an interview with Brother Gregory Holly, who is a mental health professional here in Nashville, Tennessee. And so he's going to talk a little bit about himself and a little bit why we need to be better advocates for mental health and what we can do. And then we'll, have a little question for him to kind of bring out some extra topics that we might hear, in his discussion today. So, Brother Holly, thank you for sharing your talent and your expertise with this association and with the community at large. And so I'll turn it over to you.
Thank you so much, Brother Lindsay, for that introduction. Good evening, brothers. My name is Brother Gregory Holly, Jr. I'm a most recent initiate from the spring 2022 chapter of Omicron Sigma Lambda, Murfreesboro, Tennessee. I am currently working as a mental health therapist, and I've been a mental health therapist since 2016. And I am also currently in school studying to earn my psychiatric NP as well as my DNP in it. And so what really drove me toward this career field, because it was very interesting to me. I played college basketball. I sat in the locker room with teammates who were my close friends. And, us being African-American males, a lot of times the stigma is that we're always to be strong. We're not to show emotion because that shows weakness. So I witnessed friends and teammates battle with what you call untreated trauma. Very talented, very high level potential, but we're doing mental gymnastics in the inside. And I knew then, I wish I had better training on how I could really help these brothers. Those are some of the questions I would ask myself. And so just some ways in which how we could be better advocates, because I think about my younger self and how I could have spoken up, regarding a brother that was declining, not doing well. He wasn't getting the help. And so some ways in which we as African-American men and just as people in general can be better advocates is, asking that person that you're close to those questions. How are you feeling? Paying attention to the nonverbal cues as well, like the suicidal kind of verbiage, when it comes to, I just sometimes think about a place that's better than just living here, you know, and things like that. They'll give certain cues and things. And so those are all flags, you know. But I will say once again that during this pandemic and things of such, stress added on even more to what everyone was dealing with prior to it. So when I think of grief and loss, depression, anxiety, suicidal ideations, high stress, as well as substance use and abuse, I think about, you know, where we are today and, you know, us being in what we call repairment stages. So depression rates in America has increased. It started out at about an 8.5% prior to the pandemic. And then since the pandemic, it's increased significantly to a staggering 27.8%. And out of all of those numbers, 20% of African-American adult men are 20% more likely to experience serious mental health problems, just due to the day-to-day living situations, both economic as well as family, and et cetera. Also, due to the hardships and such, since 1991, there's been an 80% increase in depression and suicidal ideations in African-American males as well, both adolescent and adults. So again, you know, when I think of the significance of mental health and, you know, how near and dear it is to my heart, practicing in private practice, seeing multiple people within our community, I've saw an increase in African-Americans coming in to get the help, whether married, whether single, and it's been very heartwarming for me. And I give 110% when they come in there. So again, I know it sounds like I'm just kind of rambling on. I'm trying to tie it all together, but I will say that, you know, the importance of mental health in our communities, you know, is very important because we deal with so many things that are genetic, such as trauma and trauma responses. There's sometimes when we're dealing with turning on the news, that could be a trigger. You know, grandma going back and forth to the hospital based on COVID scare or, you know, lung failure, just whatever they're dealing with, that adds on to it as well. But that television was a trigger for a lot of us this pandemic because that's all we had when we were on lockdown. And so all we kept hearing was data. We kept hearing COVID cases rising. We kept hearing this amount of deaths. And that's all we had was the television and the smartphone, which were significant triggers to us. And so the anxiety rates increased. I know within close family circles, alcoholism increased, substance use increased to try to numb and ease the pain, you know, because everybody has ingested high levels of stress during this troubling time and challenging time. Divorce rates increased significantly. People who were dealing with economic issues prior to the pandemic, when the shutdown happened and they didn't have what you called one of those important roles that a lot of our people felt like they didn't have inside of those jobs, they were laid off. You know, they were shut down to the last paycheck. So who's going to pay the utility bill? Who's going to pay the rent or the mortgage? Those things were still due in the midst of the shutdown. So divorce rates enhanced significantly. I saw an abundance of young people coming into the office because schools were shut down. And I saw parents coming in along with their young people. And, you know, it was just in droves. And I got to the point to where I couldn't take in new intakes because I was at my capacity. But it made me happy to see that there were people that looked like me that had put the stigma to the side and said, you know what, I am tired of suffering. I am tired of getting a lack of sleep at night. I am tired of trying to be, you know, He-Man or G.I. Jane, you know, being the strongest person, the pillar, the matriarch, you know, wearing those hard titles. You know, I'm just going to come in and just say, you know what, I'm going to give it a shot. And that's what I saw as well during the pandemic. So I can definitely vouch for that. A lot of our people were coming in to get the help. First time people coming in for mental health treatment.
Well, let me ask you this. So, and especially since you highlighted talking about people coming in for mental health treatment, when we look at Blacks in mental health, why is it that we receive so little treatment in regards to other population bases?
Yes, sir. That's a great question, Dr. Lindsay. African Americans tend to receive less treatment than other populations, primarily due to the inconsistencies and the trust issues within the healthcare community. We got a strong history in our country with distrust in healthcare. We tend to become marginalized when it comes to whether it's women's healthcare. I know a lot of my colleagues, they harped on the Tuskegee experiment. These things and conversations were going around on our social media platforms. So a lot of people in our community becoming questioning about what's in that bile duct when it comes to our vaccinations and things like that. So when we speak about mental illness and those rates in our community being low, it starts from history and just a lack of trust within the healthcare community. And I would also say this as well. When we speak of religious factors, so many people in our community come from strong foundations of elders that went to church on Sundays, attended Bible study on Wednesdays, attended choir rehearsal on Saturdays. Young people would hear a lot of times, and I've heard this personally, you don't need to go see the psychiatrist. You don't need to go see the doctor. All you need to do is pray about what's going on that's bothering you. You're not suicidal, and so people felt like they needed to tell people exactly what they wanted to hear, because to speak the truth, and what I like to call the mental cave up top, the mental cave can get deep. And for some people, they can go in that mental cave and come out. And for a lot of our people in our community, we don't have a blueprint on how to find the exit once we go inside that mental cave. So I will say that the more we speak about this and the more that the word is getting around that it is a normalcy to go in, it's okay to not be okay, we'll continue to see those numbers increase within our communities.
And let me follow with that with another question. And you spoke about the men in particular. Why is it that we see such a higher stigma, especially with us being a Black fraternity that are social in our mission to go out into communities? But why is it that even among our own selves, we see such a stigma to seek mental health treatment?
Yes, sir. That's a great question. I feel like we seek a stigma to go out and seek mental health treatment because in our community, and I know from just me experiencing my grandfather who was born in 1938, it was a sign of weakness. As a man, we were told that you don't show any emotion. If you got something going on, you pray about it and you keep going on with it, because that's just what life has defined for you. So to go and say, you know what, I'm not doing okay today. You know what, I'm just not doing okay. Bills are high, inflation is very stressful. Everybody wants to buy my home, but where am I going to move if I sell it because everything is so high? It's a sign of weakness. It's a sign of failure to us sometimes in our community as men. We want to, I heard Bishop Jake say this, and I was listening to a segment that he had regarding that question. And Bishop Jakes was saying somewhere along the lines of, it is not good for a man to be alone. And he wasn't just talking about the physical sense. He was talking about men don't do well when we don't have the answers. When we don't have answers, we become silent. And a lot of times we don't like to say emotional. We become what we like to call emotional. So our wives will ask us, or mothers will ask us, how you doing today? Oh, I'm fine. I'm good. But we know we're not doing good. But to say it, it's a form of weakness. So that stigma there, from long back when, has been inherited into the generations of today. So when we speak about our strong fraternity of Alpha Phi Alpha, and you got like distinctive men of in leadership that just don't see it being a significant sometimes to just say, you know what, I'm not doing okay. So definitely it's been deep rooted from in the past, but I do see increase today. I really do.
And so even as we move throughout this state, our district runs all the way from the tip of Mountain City all the way down to Memphis, up to the top parts of the border of Tennessee and Kentucky, all the way down to Chattanooga. Very narrow, state, but a long state filled with urban and both rural areas. And so for our brothers that are listening, and even for those that are outside that are listening, to this, what can we do in our own communities to be better advocates for mental health?
Great question. Some highlighted key ways that I feel like we could do a lot better. When I speak again about the church, a lot of us attend church faithfully every week. Increasing that mental health ministry within the church, making sure those announcements come out just like they do anything else each week at church, because that's where a lot of information is relayed. But as brothers of the chapter, I feel like, to be better advocates, when a brother comes to you, because a lot of times I know from my line brothers, it was 10 of us that crossed in the spring, and we're all pretty close. We all communicate with each other. Out of all 10 of us, at least half of us is going to call each other speaking about the stress from the week. So just giving that brother the room and the platform to speak and just vent, and we not try to fix it. We just hear him out, because a lot of times you're going to hear exactly what you need to hear as that brother is elaborating and just debriefing. He's what we like to call unpacking his emotions. And he'd rather do that with the brother than to walk back in the door and lay that on his wife, because he wants to come in and transition from that professional lifestyle into the father, the husband, and sometimes that can be hard. But as brothers, definitely just being that listening ear. And when a brother tells you, when it sounds like something like on a severe side of things, just like, man, I don't know how I'm gonna make it. Asking that brother, man, what do you mean by that? Tell me, what do you, and so just giving him that room to just talk, because a lot of times there's healing in telling our stories, even if it's no medication involved or it's not an actual live therapeutic session. When that brother has room to tell his story, he's actually healing in the process of it. Because a lot of times when people are hemmed up emotionally and they can't speak, they're not anywhere near healing yet. So if that brother's at a place to where he's talking to you, he's already headed in the right direction. So if you don't know where to get him further help at, I will also like to say psychologytoday.com. You type in there and filter it out. If he wants to see an African-American male psychologist, psych and P therapist, that is a great website that a lot of people use and that have found me on there too, that just been passing through for work and things like that. Psychologytoday.com has been a tremendous increase for our community, just trying to find the right therapist that matches for them.
And so as we look at this then more from a community standpoint, personal standpoint, as you're talking about with engaging with people, a lot of times, do mental health issues provide always open symptoms? And how do we intrinsically link that to what we sometimes might see physically? Are there always physical symptoms? Are there always something that we can see to determine if a brother is having a mental health crisis?
Yes, sir. Great question right there as well. It can be both sometimes. It's very interesting and it varies based on the person. Things that you do see sometimes, or things that you don't see, it may be things that you hear. If a person's having a manic episode, they could be speaking to you, but they could be speaking very irrationally. They depending on their genetic history, whether there's been mental illness in their family, it's just things along those lines. But I will say, for an example, something nonverbal. If a brother is isolating himself and you know that this is a person that you've known to be extroverted or someone who's outgoing that at least would be social, if you start to see him isolating himself or herself, not bathing, calling off of work a lot, just always down, always, every time you contact them, they're laying down, they're asleep, lack of energy, fatigue. Those are a lot of the nonverbal things that you'll see as someone starting to decline, and some things that you would also see physically. If you see a person and they're looking sometimes disheveled, they're looking unkept, not neat, as they normally would present themselves based on the high stress challenges that they've had faced. Those are some physical things that you can also witness. Irrational purchases. I saw that within my family tree as well, from years back. Things that you would see, like somebody could look all together, but he just went to go write a $27,000 check for a car and did not remember buying it the next day. So things like that are out of the norm. So those are nonverbal things, but physical things as well. Paying attention to the way that they keep themselves. Are they groomed? Are they seasonably dressed? Just some things that you can witness to, because you wouldn't want to see anybody with a leather jacket on starting in May, and in June. So those are red flags right there as well. So there's so many that could be both nonverbal and physical, but those are some examples that I have seen and people personally that I've seen on the decline.
And I got two more to let you go. So one question that I do have for you also is this: with this type of mental health illness that we might see, or that you might see in your professional capacity, is there a light at the end of tunnels for people who may have experienced a mental health crisis? Is there any, people say sometimes, can you simply snap out of it? Or is it something that you face over a course of a lifetime?
Yes, sir. That's another great question. There is life after mental illness. When treated and given the right attention, there is life afterwards. Seeing patients, clients come into the office. I work alongside a psychiatrist, and he's an African-American male out of Vanderbilt. And, you see people all the time that come in there in bad shape sometimes, and they don't think that there's light at the end of the tunnel. But what you have is, once you start to give it that necessary attention and the right therapy and psychotropic medication to balance out that neurochemistry appropriately to where they're thinking rationally again, so balancing out the neurochemistry along with getting the proper therapy, there's life after mental illness. I know for a fact that a great uncle of mine battled with paranoid schizophrenia, and he would call the police all the time thinking someone was trying to come in, but they never really were. The house had cameras and everything, but my family that did not have mental health training, they would always say, I wonder something in him, there's a certain spirit. And I said, no, he just needs to have his medication straightened out, and he needs to be lined up with the right therapist. Sure enough, to this day, I will say that my great uncle, you couldn't tell that he had a breakdown 5 months ago, because the right medication therapies were in place along with therapy. And that helped a whole lot. And so he battled with responding to stimuli. And, it just didn't, it was a hurtful scene. But as to what your question was asking, is there life after mental illness? Is there a light at the end of the tunnel? There sure is. And it starts by just picking up the phone or having a loved one or a best friend take you in somewhere to just give it a try. There's no harm in just giving it a try. If you feel like the therapy that you receive from intake does not match with you, you're not bound to stay with that therapist. You could shop around to find the right fit for you. But I will say that life is forever fleeting. and we look up and it's already about to be May 2022. So we don't want to let life pass us by, waiting on the day in which we just wake up one day and the mental illness is gone, because depression won't treat itself. So as other things. But if we just give it a try, to give it the correct attention that's needed, I guarantee you, and I vouch on this 100%, there is great life at the end of the tunnel, for sure.
Awesome. And so I'm going to leave you with this last one. I noticed that in our statements, we often hear this phrase. And as a brotherhood, as a nation, as a community, as a people, I really like this phrase. And I hope that it can be a standing phrase for all of us as we go forward. And the phrase is simply, it's okay to not be okay. How important is that for us to leave on that note, to sometimes say it's okay to not be okay for a situation?
That's a very powerful statement, actually, in our community. And I wish I heard it even more on a daily basis. That gives our community the validation to say it's okay to come on out here and just say that you're not doing okay. If you've had a stressful week, if you're still grieving from a loss of a loved one that meant something near and dear to your hearts, as well as the family. Some people don't want to bring up that stuff because it seems like, well, I'm just rambling on. I don't want to bring stress to other people's households and such. It's okay to not be okay. It's a door opener. And I say it's a door opener because you never know what a person next to you is really thinking about and what they're dealing with, because so many people are having battles internally that never feel comfortable on saying it out loud. So saying that it's okay to not be okay, it's definitely a validation statement. And it gives people that key to just open that door and just say, you know what? I'm glad to hear you say that, because I really ain't doing okay this week, And I'll say this as an example. Close friend of mine, as he works in the DA's office. He's an ADA attorney here. And he and I went to college together. Very smart brother, very confident and things like that. But working in the environment that he works in, prosecution, it's stressful because you see so much happening on a daily basis. And there's not a lot that you can do about it. Well, I've always looked to this brother as somebody that I can call and I kind of vent to him. But I didn't stop and think that this brother's always having to be a pillar. He's the man that walks into the courtroom, that has to be confident, fighting for somebody's life in case, so therefore they can get the best outcome. But, he recently told me, man, I haven't been doing okay. And it all was sparked off a conversation that we were having from my experience in school. And I had a mental health topic I was running by him, and that's what led to that. And just like that statement, it's okay to not be okay, that was a door opener for this brother. No matter how strong he is, no matter how strong he is on paper or in the courtroom, you're human. You're definitely human. And people need to know that it's okay to be human. And we have to learn to be kind to ourselves when we're opening that door. If we're not doing okay today, that's okay. This is just one day. And I always heard this statement too, before I conclude, the mind will always repeat what the heart struggles to delete. And when we say it's okay to not be okay, sometimes we find ourselves running through repetitive thoughts from a day-to-day basis. And we're struggling to let it go. Sometimes it's hard to let it go. Sometimes it's hard to let go of the job that laid us off. And it's hard for us to become future oriented. But it's okay to not be okay. It's definitely a validation statement that we should say more often than none, for sure.
Awesome. Thank you, Brother Holly. And we're going to leave it with that. And I'm going to turn this back over to Brother Basil for a closing remark.
Okay, thank you very much, Brother Dr. Lindsay, and Brother Holly. Thank you as well for for being our subject matter expert today.
Yes, sir.
We want brothers to know, all you brothers should know that if you are struggling from any kind of mental health issues or anything that might be out of the ordinary, you are not alone, and there is help for you. There's help for all of us, because this is not just you. You're not in this alone. There are many people who struggle. You just don't know it. There are many people who struggle from mental health issues, and we want everybody to be able to reach out and get the help that they need. There is a statewide crisis number, as well as a national crisis number that we will be posting along with this video for anybody to call and reach out if they so choose to take that route to seek help. So thank you again. This is just the kickoff from the Health and Wellness Committee, starting off with the Mental Health Awareness Month in May. So there's much more to come. Will hopefully be a different focus on each week this month. Be looking forward to it because it's coming out for you. And we hope that you will take advantage of it. So thank you very much. I appreciate you joining, and thank you for your participation.